One of the biggest problems is dealing with prior authorizations.
Each insurance, we have a portal login that we can use and submit the prior authorization easily. It just takes some minutes, just as long as we have all the documents that we need.
Hey, good day and welcome to the Offsite Team Podcast. I'm here with my good friend April, and what we do here is we solve the problem that DME business leaders have that try to find dependable, affordable employees for your DME business, especially if you're running the Brightree software. So, hey, April, how are you doing today?
I'm good. How are you?
I'm doing well. It's 2
Good.
o'clock in the afternoon here in Yakima, Washington. And what time is it in the Philippines?
Right now it's 5 a.m.
5
5
a.m.
in the
So
morning.
you
Yep.
have your cup of coffee, and we're all excited. Hey, we're excited for a second podcast today. And today, one of the biggest problems, I've now run Howard's Medical Supply for 19 years, is dealing with the problem of prior authorizations. It drives me absolutely nuts because it should be as simple as customer patient comes into the store, they hand a prescription, we verify insurance, we dispense the prescription, and we're done. But what insurances do, they make us jump through like this ninja warrior video game, or where you have to do this and you have to verify this, then you have to send this paperwork in, and you have to do this by this date, and if any comma or period is off, we're going to deny your authorization, and then you don't get paid.
Exactly.
We get frustrated, the customers get frustrated, it takes up so much time, it's a pain in the rear end. But I think we've kind of figured out a really good way around it. How do we, at Howard's and Offsite Team, how do we get around this problem?
So the thing is, for us, what we do is first we made sure that we have the documentations complete. So from prescription to chart notes to whatever documentation that the insurance requires for our authorization, we need to make sure that we have that by having the checklist for clinicians. We have those, and
we have detailed checklists.
Yes.
Everything that every insurance requires, whether it be Medicare, Medicaid. In our neck of the woods, we have lots of Medicaid plans, such as Community Health Plan of Washington, Molina, the Blue Cross, Blue Shields, you name it. So, and every insurance can sometimes be a little bit different, doesn't it?
Yes, that is correct.
So when working with our offsite team, give me a couple examples of how like the prior authorization process works and how it might even differ from insurance to insurance.
Right. So working with the offsite team isn't a problem with submitting prior authorization, because what's good about us is that we have an access to insurance portal. So each insurance, we have a portal login that we can use and submit the prior authorization easily. It just takes some minutes, just as long as we have all the documents that we need. Unlike with some other companies, they have to call the insurance, which takes a while.
Oh, it's a pain in the rear end, because we'll call the insurance and sometimes we're on hold for like 45 minutes, aren't we?
Exactly. Sometimes even more than an hour. So unlike with us, we have the access to the insurance portal, so it's easier to attach the documentation that we have. We just want to make sure that everything, that the documents that they're requiring is with us. That way, everything will be submitted smoothly. So,
and the nice thing is, for our US-based workers, we know the prior authorization process is going to take a little bit of time. So we have an offsite team all working in the Philippines. So they'll be working, calling insurances, working on the back end prior authorization paperwork. But let's say they're on the phone waiting with one of the Blue Crosses. They can work on other projects at the same time on their computer, basically double working, two patients at one, because you're kind of waiting and figuring things out. And then our US-based worker, we're taking care of people in the showroom. So we're not in the old days before we had the offsite team. What we're doing is we're literally sitting on the showroom floor. Customers are having to wait for 45 minutes while we're on hold. It was a waste of their time. It was a waste of our time. No one won. It was really frustrating. So tell me, what are some of the things that you've learned? You don't do prior authorizations yourself now, but you are training the offsite team. What are some things that you've learned in the process that speed the process up?
For me, the most important one would be checking the checklist that we have, making sure that we have all the documents that we need. And depending on what DME item do they require, because sometimes there are DME items whose diagnosis driven. So we want to make sure that we have that documented on the chart notes. So even though we have all the documents, if it's not the diagnosis that they're looking at specifically for some other insurance, then there's a huge chance it will be denied. So those are the things.
But let's use a really easy one. Let's say, let's say one of our diabetic therapeutic shoe patients, because we know the main diagnosis is not, it has to be diabetes for that type of shoe. Let's say it's not diabetes. Let's say the doctor messes up and does like high blood pressure or an ulcer or something like that. How would you go about getting that added so we can work with that product? What do you do? Do you call the doctor's office? Do you send a fax? How does that work?
So first is I usually send a fax to the doctor's office, letting them know that we have to have this type of diagnosis, which incorporates the DME item that the patient needs. So it has to match what the item is needed. Now, if I did not receive any response from them, what I usually do is call them to talk to them directly and explain everything. We want to make sure that it's documented. And we have this thing that's called an addendum. So that's what they're doing.
We can do chart noted, or we can do it. The doctor's office can do chart noted addendums, which work.
So that works with the insurance. Just as long as it's added and documented, we can go ahead and proceed with the submission of prior authorization.
Yeah, absolutely. And what I like about this, every time our offsite team works, we use Brightree, which is our software. There's other softwares out there, but every time one of our offsite team members is making this request to the doctor, they're putting notes into Brightree, and then they're using the whip state, which basically says, hey, we're doing this. And so if the customer comes in and says, why don't I have my shoes? Well, I'm going to use the generic term, Mrs. Smith. Mrs. Smith, we have called your doctor's office, we have faxed your doctor's office, and they haven't done it. And what I like about what the offsite team does is you make it easy for me, who's running the business, because they're not going to get mad at me. They thought it was our fault that we haven't done it. No. And then you'll just say, you know what, Mrs. Smith, maybe you should call your doctor's office. And then they do it. It finally happens and it all takes place. But what I love that the offsite team does is, by you guys doing this, it allows me to work with the customers, and you save us so much time. It's really, really nice.
Also, additionally, we're making the customers involved. So say, for example, the documentations that are hanging, we haven't been able to get in touch with the doctor. What we do is we call them, make them involved, let them know this is what's going on. And then they call the doctor's office, which speed things up.
Yeah. A saying I like to say is one of the biggest source of disappointments in the United States today is unmet expectations. And we want to bring the customer involved in the process so they know exactly where things are at. Because it could, if it was something as easy, let's say, as diabetic shoes, all we have to do is measure the shoe and order it, and we could really almost have it done within a week. It doesn't work that easily because the documentation process doesn't go that fast. What the offsite team allows us to do is allow the documentation to go as fast as possible according to insurance rules and regulations. And let's be honest, I am convinced that some insurances want to drag things on as long as possible so as to avoid paying the claim. It is what it is. That's another discussion for another day. Well, it is what it is. I'm not going to go down that tangent, but what the offsite team does is it speeds the process up as fast as it can do. Hey, question. So here's a question. What is your favorite insurance to work with on prior authorizations? Not that there's any best, but what is your favorite one and how come?
I like UHC.
Is that United Healthcare?
Yeah, sorry. Yes, United Healthcare.
That surprises me because I have a lot of people who don't like United. What do you like about United Healthcare's prior authorization process?
Well, first and foremost, the portal is like user friendly. So first you check the code, the HCPCS code and the DME that they need. So by the way, HCPCS code is the insurance uses to identify
the procedure code.
Yes. So you just put that in and then they'll tell you whether prior authorization is required or not. And if it's required, it then routes you to another page where you can just submit it. So, you know, how fast and easy that is. You don't need to call the representative on the phone just to ask whether prior authorization is required or not, because the page itself will tell you. Plus, it also give you a reference number that you can upload in Brightree in the main patient's account, letting you know that we checked this and prior authorization is required, or we submit it.
Yeah, and that does make things as smooth as they can be. Now, what's hard with UHC is sometimes they have Medicaid plans, they have Medicare plans, they have private plans. So even UHC, not all of the plans are the same, and you don't necessarily see the reimbursements as much as I do. So I know the people listening to this podcast are typically your DME business owners. So they might like, well, hey, the process might be easy, but they're not paying as much as we should. That's not what you're talking about. You're just talking about the prior authorization process. You're like, hey, it's pretty easy with UHC because of this. And one nice thing is because we have as many offsite team members, those businesses working with us. Let's say you get stuck somewhere. You can call us and say, hey, how do you guys do Molina claims? How do you do UHC claim? We can kind of give you a lot of help in the process because we want you to be really successful business owners. Because would you rather spend your time taking care of customers and marketing and doing what's going to improve your business, or would you rather waste more time sitting on hold with let's say UHC, when all you needed to do was actually log on to the portal? And you know, what are more efficient ways of doing things? So, you know, that's the thing I love about working with offsite team members. So next episode that we're going to be doing on the Offsite Team Podcast is we're going to talk about the fix for PAP documentation. And, you know, PAP documentation is part of the prior authorization process, but we do lots and lots of CPAP, BiPAP, new setups at Howard's Medical, but also part of this is the resupply and what happens when someone goes from one insurance to another insurance. And there's a great fix for PAP documentation. But in the meantime, hey, thanks for doing the podcast with me, April. If you have any questions about maybe you would like to have an offsite team member with your local DME store where you can help other people out, all you have to do is just go on to offsiteteammember.com, schedule a free consultation. And I think, what is it right now, April? We have 3 team members ready to be placed with other companies. Is that right?
Yes, that is correct.
Yeah. So, and things are always kind of changing, because what we do is we train people up ahead of time. We fully train them. We train them in Brightree. So if it's Brightree, it's seamless. Now, if you use another software, it can still happen, but it takes a little bit longer to learn the ins and outs of that. But currently we have 3 ready to be placed. And then it's really, really simple. But hey, in the meantime, until next week, thanks for joining April and I, and look forward to talking next week.